Tea Life Hacker here. Hello, guys. We are going to talk about, are you cut out for skilled nursing? Is this the area that is a good fit for you and for the skilled nursing facilities? Especially during these current times where people are getting sick, there is low staff, high demand, and a lot of burnout happening right now. So, it is important to note, do not go into skilled nursing until you watch this video. Exactly, that's right. This video is very important for you. If you are considering to go into skilled nursing, you're in occupational therapy and potentially in other fields. I am an occupational therapist and I want to share what I found to be very pertinent in being successful in nursing facilities and what they are looking for. So, first of all, you will need to understand your own personal values and your own skills and capacity, interests. You definitely need to understand yourself in order to understand if this is the right fit for you. So make sure that you reflect on that, and I will have another video that I'll put the link in the description box when that is ready, and that video is going to talk about traits that are important to skilled nursing. So, the first thing that's most important for you to know about if you are going to go into a skilled nursing facility or even considering it is understand, know, be aware that there is, as I mentioned, a lot of burnout right now. This is not necessarily going to be the case everywhere. I sure hope not. But I will give you an example of how bad the burnout can be, to the point where in one of the facilities there was a patient who had died, unfortunately, of the stuff that is going on right now, and the patient was unfortunately was left there out in the room, out in the hallway, because there are patients overflooding in these facilities, and the patient was left, their body was left out in the hallway, and the staff had put a blanket over the person's body, and that was that. And of course, we hope this does not happen in any facilities ever again, but that is how bad it is right now. Like, there is stress all over, and because of that, you will see that the staff is very, very stressed, and they are kind of needing to do, like, it's very fast paced. You have a lot of patients to see, especially because of this really critical time where there's not enough staff and a lot overflow of patients. And many facilities are hiring people right now with the expectation that you go in there without training, because there's no one who can really train you in these times. There's not enough time to do that. And so you also, like I said, you'll be facing circumstance where people may not be able to help you as much as you're needing help. Especially if you're a new grad, be very careful. If you're a new graduate, you cannot necessarily expect training. It is best if you can get training, and that's great if you can. But many times in these times, you will get thrown in and have to really learn quickly. And there are high expectations. Now again, I'm speaking on nursing homes that I know of. So if you have a different experience, please share it in the comments below. And please share your insights, what you've experienced, and help others to make a better informed decision if this is the right place for them. And so often nursing homes are on a very business-like motto. So they are very focused on high productivity. And that means that most of your time should be spent with the patients, not as much with documentation, preparation. It's mostly with the patients. And The patients in the facilities can range potentially from minimal assistance, whether it's just like giving a lot of queuing and other type of assistance, to dependent, to max times two, meaning you need two people to assist that person. And what I'm finding, what I've seen, it's many times a lot of manual work. I mean, a lot of you having to lift the patient. If you can, get a Hoyer lift. But keep in mind, sometimes it can be hard to get help to help lift the patients because it is so high demand, and again, staff is really pressed. And often the patients are coming from the hospital, and the patients are brought to their facilities from the hospital because this facilities is 24-hour care, 24-hour watch, and so you would expect that the person will need more help than a typical person, and that there can be complications that need to be watched out for, precautions that need to be followed. So those are the key things that I really encourage people to consider if they are going into nursing homes. Granted, I love nursing. I love that it is very fast-paced and challenging, but if you are a new graduate or if you are not so familiar with the setting, this may not yet be, make sure you advocate for yourself. Advocating for yourself is extremely important, because people are needing to do things that do their things. So you have to push for help for yourself, push for the assistance you need. And again, please feel free to write in the comments below your experience. And we also do very much need people in nursing facilities, very much, because we are in this crazy time right now, and assistance is needed as best you can give, but also make sure that you take care of yourself. That is also very important. You can't take care of others unless you take care of yourself. Alright, so I'll leave you with that. Again, write in the comments below your experience, your questions, and do like and subscribe to the OT Lifehacker channel. Look out for the next video on the 6 traits needed for skilled nursing. Bye bye!